if Medicare is about everyone paying according to their means, those with means should pay.
But don't we do that through our taxes? Isn't that the whole point of progressive taxation?
Yes, but as you know, the Medicare levy barely covers a fraction.
No, income tax. Yeah, you're absolutely right.
Expenditure.
It's our income taxes are where the bulk of our healthcare spending, the bulk of that health spending comes from income tax, not from the Medicare levy. But as a high income earner, I pay more income tax. Why am I not entitled to decent healthcare because I pay high taxes? Well,
the way I see it is that the Medicare levy is like your admission fee to a community club. When you pay your membership subscription to the RSL club, you actually gain admission to the club, and then you pay for your subsidised services, whether they meals or whatever, as you go. And I don't think that's unreasonable for those of us who can afford to pay for our own care.
But if I was a member of the RSL club and I paid a fee for admission, and I also paid a monthly fee, and I paid a bigger monthly fee to access services at the RSL because I was a higher income earner, I'd expect to get services as a result of that. The analogy doesn't hold true, because it's actually our income tax that's paying for our healthcare more than it is the Medicare levy.
Oh, that may be, look, I respect your point. My view is that those of us who can afford to do so should basically expect to pay at the point of access. I don't think you or I should expect to go to a GP or any other medical practitioner expect to be bulk billed.
But what I'm just interested, this will be my last question, then I'll hand over to Senator Lyons. Why this philosophical? Because let's try and park the ideology at the door. If I'm paying, we've got a progressive taxation system in this country. The result of that is that contributes to a national health insurance scheme called Medicare. And regardless of what people say about Medicare, one of the great benefits in terms of value for money is you've got one insurer who drives down costs. That's why we're a much cheaper health system than the US is. Why is it more efficient, in your view, to pay for the services at the point of access rather than through a national insurance scheme, which is essentially what Medicare is, compulsory national insurance?
Yeah, public insurance, but with private insurance, so you still make a contribution, you pay in excess. Effectively, in public insurance, there's this notion with bulk billing that it should be entirely free to the patient at point of access if appropriate. Now, what I'm saying is that for those who can afford to do so, that should not be available. Though it's interesting, and I'm not going to claim that I have the whole country behind me in terms of my assumptions, but certainly in terms of the reaction to this proposal, the thing that surprised me is in terms of some public comment, but also in terms of private comment, that people who are less well off, people who do have chronic illnesses, people with young children who basically have are frequent users of general practice services, actually value those services very highly and say, look, I mean, I'm prepared to either consider it or pay it. These are people in the group that you're talking about who absolutely are keen to, nobody's keen to pay anything, let's agree on that, but who are willing to contribute a modest and appropriate level of a contribution to the cost of that service.
Well, we obviously talk to different people. Senator Lyons.